you did a lot of research. You've been doing a lot of research. What are the most shocking trends that you have seen?
Thanks for having me. Yeah, this is the third year we've done this study. And, one of the trends that's just astonishing is how each year we see more and more of the population that has a need. And of course, the pandemic accelerated that. This year, we're seeing more than 40% of adults have some sort of depression or anxiety. 60% of those under 25 are presenting with these needs. So just staggering numbers of the population have these needs right now.
So you've just raised a lot of money. You're working with Blackstone, $1 billion valuation. What do you think the future is of on-demand mental health, and how does it differ from, a traditional therapist or psychiatrist, which, many people have had access to for years?
Few thoughts. I mean, first of all, we raised the money this year from Blackstone because we recognized that there was this increasing need. We don't have anywhere near the number of providers to take care of all of these people. And as we looked at the cost to society, the estimates are that it costs the United States alone about $1 trillion a year to manage the mental health issues that we have. We recognize that this may be the single largest societal issue of our time. And we wanted to raise money to make sure we could continue to invest in the solutions needed to solve this problem. And Ginger's focus here is, how do we take technology? How do we take research and development? How do we create new care models and payment models? And finally, how do we scale the amount of care that we can deliver to solve these problems for our society?
So as we go into some sort of new normal, we're in this sort of messy middle period. What are your biggest concerns about the disconnect between employers and employees, between governments, schools, and students?
Well, there is some good news. I think that if you look at the results, what we're seeing is this period has actually increased the understanding of the need. So, huge numbers, like 92% of CEOs are saying that their companies have increased focus on mental health over the last year. We're seeing 94% of CEOs actually saying that they received some kind of mental health support themselves over this period of time. But as you said earlier in the segment, there's still a gap between the perception of what companies are delivering and what employees are feeling on the ground. So I worry about that. I worry that companies think they're doing enough, but then they're not actually, because employees aren't seeing it yet. And I think it's going to take companies not only focusing on providing solutions, but also providing communications, talking to their employees, making sure that employees know it's okay to reach out and get help, basically helping to reduce that stigma that still seems to exist out there.